Hi, my name is Dr. Sath, one of the lovely dentists here at Love Teeth Kids, and I'm going to be talking to you today about what is inhalation sedation, also known as laughing gas, also known as happy gas. Now, when it comes to doing dental treatment, it's really important that your child is as comfortable as possible throughout. Now, in order to achieve this normally requires the use of local anesthetic or numbing. This way we can do the necessary treatment while making sure that there's no pain felt at any point. Now, in order to give the local anesthetic, the numbing, it usually requires an injection. Now, this is the part that people all freak out on, kids and adults alike. Now, most kids could actually tolerate a numbing injection quite well, especially using some of the tips and tricks that we have here, our sort of strawberry numbing jellies and little distraction techniques. We have a TV on the ceiling, all these different things that really kind of take the mind off it, and actually we find we a lot of the time can do a good numbing injection. But for some children, it's just a little bit too much. They can't quite tolerate it. And actually, in other cases, even if we get them nice and numb, the treatment we need to do afterwards, it's quite a lot. And if we're doing lots of treatment as well, lots of different types all together at the same time, it can just be a little bit too much for young kids. This is really important to keep in mind as well, because with children, it's not just about doing the treatment they need right now, but it's about ensuring they maintain a good, positive relationship with dentistry. So whilst, we could try and do a big bit of treatment now, if it makes them a bit scared and anxious going forward, was that really the right option in the first place? So this is where my favorite option comes in, inhalation sedation. Now, inhalation sedation, also sometimes known as laughing gas, also sometimes known as happy gas as we refer to it, also sometimes known as gas and air. It is a relatively light, mild form of sedation. What does that mean? So you have this little nasal hood, as you can see on my friend Sleepy the Bear, okay? You have this little nasal hood, it just goes over the nose and you breathe in this gas mixture. It's nitrous oxide and oxygen, so that at no point are they breathing anything less than some pure O2, but the key thing is the nitrous oxide. Okay, this is the same gas and air they give pregnant women whilst they're giving birth, so it is incredibly safe. And what does it do? Sedation makes us sleepy. It doesn't put us to sleep. That's general anesthetic. That's kind of the really last resort we always want to try and avoid, but it makes us sleepy. And so for young kids, all it does, they stay fully awake, they're fully present, but it just relaxes them. I like to say it takes them away to the fairies. So what is gas and air? It is a mild form of sedation. It makes the children more relaxed. What it therefore means is that we can then give any numbing injections that are necessary, and if we're doing lots of treatment, we can kind of do it all in one go. The other really brilliant thing about sedation is it has a very mild amnestic effect, a very mild memory effect. Basically, they don't really remember what goes on. All right, so that way, if we're doing a lot of treatment, afterwards, at the next appointment, they come back, they don't really have any bad memories, and they're just as happy to be back where they were. The type of sedation we use, again, we make it nice and fun. So we have lots of different scented nasal hoods, nasal masks, nice and soft and squishy. We have bubblegum, grape, we have strawberry, orange, loads of different ones. Again, to get children prepared for sedation, we have lots of resources. We send them different videos and animations. We sometimes send them home with these to practice wearing them. And sedation is a really good option for children. The youngest we tend to do is around 4 years old. However, we have done sedation for younger. The main thing is they just need to be comfortable enough to have the hood on the nose, breathe in the gas. So if they're a bit younger, but they can follow instructions, it's a good option. We can give it a go. The other main thing to understand and know about sedation is that it's not the strongest form of sedation. What do I mean by that? It means that you need to be somewhat comfortable, somewhat relaxed and cooperative in order for you to breathe in the gas for it to work. If you're really anxious and really fighting it, unfortunately, it doesn't work. For that reason, inhalation sedation is not always the best option, and it's very important, therefore, that we do have a good assessment before your sedation appointment, just to make sure that actually, we think this treatment will work, and actually is the best option for your child. So that essentially is it. We now know a little bit of what inhalation sedation is, how it works, why it works, who it's great for, and who maybe it's not the best option for.